So let me introduce you to case taking and case proforma in fevers. These are one of the vital aspects we need to understand in fevers if we want to treat fevers. Let us go through a few scenarios to understand how will different patients exhibit symptoms and how will we understand them to prescribe in fevers. So, scenario one, patient comes and he has lot of symptoms. This will happen with most of you, like 80% of cases. Patient will tell you, I'm having fever since yesterday. There is chilliness, there is sweating, and I'm having cough and cold, and the headache is also very bad. Can you give me some medicine so that I can resume my work soon? I'm having a bit of throat pain also, and there is body ache which is very disturbing. So, when you see such a case, the solution to this problem is categorization of symptoms. There are different categories in fever cases which you need to understand. I've just labeled it as category 1, 2, 3, 4, 5. But in the case taking proforma, which I'll be sharing with all the participants of the fever workshop, which begins on 15th August, I'll be sharing the different category names and what you will be seeing in those cases of fevers, what is important in those fevers. Solution 2. So, yeah, 1 minute. Yeah. So, let us go to scenario 2. And in second scenario, we see that patient feels constantly chilly. Internal fever is there. Or I am feeling feverish. Should I get my blood checked? Do you think I need to take medicine? Is it fever or is it just the weather changes which is what is bothering me? What will you do in such a case? There are some rubrics in the repertory. For example, in the Kent's repertory, there is a rubric which says chilliness fever during, but there are no remedies because it's a cross reference to somewhere else. But if there are frequent attacks of chilliness, which happened in one of my cases, I gave him ferrum metallicum, which helped him. Similarly, there is another rubric which says that there is chilliness without any subsequent heat. He just feels chilly. There is no symptom as such. There is no feverish feeling. Now you'll have to understand from all these remedies. So, our job is to understand the case of the fever, find the rubric, understand the remedies. It's a process. Let's go further. Scenario number 3. Child is having cold, cough, fever since the last 3 to 5 days. He's crying a lot. Patients, the parents have not slept since the last so many days. child and the parents. What will you do in such a scenario? The solution is to understand the age group, whether the child is in dentition period or before the dentition period. If he is already a toddler, he is in the 1 year, 2 year, 3 year age category, then the presentation will change. What is the cause? What are the symptoms during fever? And again, a categorization. For children, it will be slightly different. So, you will learn this in the fever workshop. Scenario number 4, pathological condition. Patients nowadays enter with reports in your hands. The reports show that there is NS1 antigen of dengue positive. All the common symptoms of dengue fever are present: body ache, eye pain, fever, and some symptoms here and there. What to prescribe? The solution is that look for some peculiar cause or symptom. Check for physical generals. There are some specific remedies which we can think of in such fevers. There is a rubric in the NAIRS repertory which says that there is fever and dengue fever specifically. There are 16 remedies. What are the characteristics of these remedies? That is what I'll be covering in this fever workshop. Scenario number 5. Again, a pathology with fever. Patient comes with typhoid report positive. Allopathic doctors are curing such patients left, right, and center. They are seeing scores and scores of patients. It can be 10 to 15 a day to innumerable cases. But a homeopath has a real tough time to manage such cases. What will you do in such a case? The solution is that it is as good as chronic case. Number one thing you have to understand, you need to categorize it into various different categories, which I have laid down and which I'll be sharing in the fever workshop. Follow the case taking proforma, because without following a proforma, it is not going to lead you anywhere and it will be a lot of symptoms, a maze of symptoms, you will get lost. After 15 years, I realized that you need a proforma to your case, especially in fevers. Can you pick up some specific symptom, or you'll have to consult the entire case? From the repertory, different chapters will need to be consulted. If you have a good hand in repertory, you can consult a specific repertory like Boninghosen characteristic repertory. But all depends on how much deep the case is. One more scenario. There are various locations affected. Pathology is in one organ, concentrated entirely on one organ, and fever is caused due to it. What will you do? For example, one of my case had severe succession of abscesses and there was fever. You have the rubric which gives the remedy hippozenum. Curing the abscess took out the fever as well. There will be patients with pharyngitis. There is a rubric in the fever chapter, pain in the throat with. There are 17 remedies. Then you will have to go and find out the peculiar symptoms of the remedies and also fever related symptoms. So these are the complexity in treating fever cases. And that is why I have come up with the fever workshop, which begins from 15th August 2024 every Thursday and Friday from 5 p.m. to 6:30 p.m. and it ends on 13th September. Every Thursday and Friday, you will learn about case taking in fevers, case taking proforma will be provided, which you can apply in all the fevers which you will be seeing from day one of the workshop. What will be the patient expression and how will you convert them into rubrics? What is the materia medica of different remedies and their rubrics in the repertory? All this you will learn through clinical cases before and after videos in front of your screen. And the most important thing what a homeopath often ignores is the diagnosis and prognosis prediction. In such cases, you need to have a sharp clinical acumen. If you have any cases, those cases will also be discussed. You have all the details on the screen to register for this workshop. It is going to be an investment for your future so that you can tackle all the different fever cases with confidence. I look forward to help you all, guide you all, and enlighten you all with whatever knowledge I have from the last 15 years. Let us join together and help all the patients who have grave pathologies. It can be functional fever or pathological fever, and take this forward for the art and science of homeopathy.